Every third adult, so every one in three Indian is a diabetic. Good evening, everybody, and welcome to Nature Fit's Health and Wellness podcast today. And guess what? What are we talking today about? We are talking about something we have heard so very often. We are talking about the health challenge called diabetes. Some facts before we get into a detailed understanding of how we can prevent diabetes and what is diabetes as per Ayurveda. Every third adult, so every one in three Indian is a diabetic. India is known as the diabetes capital of the world with over 100 million people already diagnosed. Worldwide, over 530 million. So it doesn't stop only in India, but even worldwide, diabetes is the most widespread ailment or a lifestyle disorder. But we have some good news. Type 2 diabetes can be prevented, managed, and even reversed with the right lifestyle, nutrition, and mindset. And that's exactly what we are here to explore today with our special guest, Dr. Gaurangi G. Karmakar. She is MD in Ayurveda. She is a leading Ayurvedic physician in Mumbai, specializing in lifestyle disorders and diabetes care. A BAMS graduate from Tilak Ayurveda Mahavidyalaya, Pune, with an MD from SMBT Ayurveda College. She has over 20 years of practice in Thane and has delivered lectures across corporates, institutions, and medical conferences. She is the coordinator of Ayurveda Department Maharashtra in BJP. Vaidya Vikas Agadi. She has won many, many awards. So, welcome, Dr. Gorangi, and it's wonderful to have you here as always.
Thank you.
Yeah. So let's start with something, very interesting that we want to understand from you. That what does Ayurveda say about diabetes or Madhumeha, and how is it understood differently from the modern medicine?
See, 3,500 years back, Egyptians, they were aware of this fact, but they were not aware of the name of that entity. In the second century, Roman physician Aristeas, he has given the name diabetes to that entity. And in the 19th century, what has happened? The modern science, they came to know about the physiology and biochemistry about diabetes. And now we are in the 21st century and still the researches are going on. And American Diabetic Association, it conducts a course for general practitioners for diabetes. And in their first module, what they have stated, it is a actually proud moment for Ayurveda. They have stated, they have described that 5,000 years back, Indian scientists, that means our Rishi Muni, has described diabetes very elaborately. And in that, it is already described that diabetes is a metabolic cum vascular disorder. Previously, it was thought that diabetes means mere sugar in blood. But nowadays, even modern science came to know about the fact that it is not the mere sugar in blood, but it is the metabolic and vascular disease. In Ayurveda, it is told it is the disease of Medovasrotas, that means disturbed metabolism in fat. That means some patients are obese. It is told in Ayurveda it is a disease of Mansavasrotas. So we have seen some lean patients who they have developed muscle dystrophy. It is a disease of Rasavasrotas. That means the enthusiasm of the patient it gets reduced. Their energy levels are low. Sometimes if the sugar is not in control, so in that case the patient is feeling disturbed sexual health, they may get erectile dysfunction. It is the disease of Raktabasrotas. That means the modern science has explained the vascular disease in that manner. So some patients, they may develop hypertension, high cholesterol, heart diseases. So it is a vascular disease. If the sugar is not in control, so the patient may develop diabetic nephropathy, that means kidney disease, for which patient has to go for dialysis in the further life, right? Some patients may develop diabetic retinopathy, that means patient may their vision may get affected because of the diabetes. Patient may develop diabetic foot, diabetic wound, and sometimes their leg may get amputated. So there are many things which are described already in Ayurveda. It is a disease of Majjavasrotas. Majjavasrotas is related with brain. So nowadays there is new invention, that is the type 3 diabetes, which is called Alzheimer's, and it is already told in Ayurveda. So if we see in Ayurveda, it is described very vividly, elaboratively, and the types of the diabetes, that means 20 types of diabetes is told in Ayurveda. And not only the types are told, but the solution is also mentioned. And while giving the solution, not only the medicine, the solution is given to reverse diabetes. So nowadays, WHO is also accepted the fact that diabetes can get reversed. Nowadays, they have given the terminology not reversal but the remission. So in Ayurveda, it is told that diabetes is definitely reversed, but the terminology is prameha. And prameha is of 20 types, and it is maybe due to three types. That means one is due to kapha. If kapha gets disrupted, then 10 types of prameha is developed in the patient. If the pitta gets disrupted, then 6 types of prameha get developed in that patient. If the vata gets disrupted, then the 4 types of prameha is developed in that patient. So one of the Vataja Prameha is told asadhya. That means it is not curable. But a Kaphaja Prameha and Pittaja Prameha, they are definitely get the reverse. And with in Ayurveda, there is a perfect solution for this Kaphaja and Pittaja Prameha. So whenever we are talking about diabetes, people, they are thinking the name is Madhumeha, as Madhu, that means honey is sweet and sugar is sweet. So that the some so the people, they are putting this 2 plus 2 together, and they are calling it Madhumeha. But in Ayurveda, the entity is called Prameha, and diabetes comes under the umbrella of Prameha, and Madhumeha is uncontrolled diabetes. So as a proud Ayurvedic doctor, I would like to say that whatever the modern science has discovered, yet it is already told in Ayurveda 5,000 years back.
That's really something which we should be proud of. The time when there was no technology, we did not
Yeah.
have too much of knowledge. At that time also, we had such insights about this disease. So going further, it's very surprising. We are not happy to be the capital, diabetes capital.
Yeah.
So what is the reason? Why are we seeing so much rise or in diabetes today? There is children, we can see children are having diabetes, we can see young people having diabetes. पहले कहा जाता था कि it is only 35 के बाद आपको diabetes हो सकता है, but अभी तो we are seeing. So what do you think are the lifestyle or the diet factors which are actually leading to this disease? Yeah.
Yeah, as you rightly said, previously diabetes was developed in the fourth and fifth decade of the life of the person. But nowadays, we are seeing even it is developed in the young people. Even 6 months back, I have diagnosed a girl of 16 years old, and she was diagnosed as a type 2 diabetes. So what I have observed in my practice, that these girls, or people say children, right from the 8th standard, they have to complete their school hours, and after that they used to go to tuitions or classes. So what they are doing after finishing their school, they go to classes, and they study lot and lot, and the brain utilizes the glucose, and then they feel hungry, and after that they grab whatever they want, and they eat fast food, junk food, and after reaching to home again they have something. So what happens, whatever they are eating, it is a carbohydrate rich diet, because whatever we get in the form of fast food and junk food, it is a carbohydrate rich food. Okay. And when they reach home, they again consume something, because they are scared of their mother, definitely. So they eat just for the just to avoid the anger of their mother. And this is how they just take the high calorie intake diet, and that is why the insulin resistance get built up in their body. And what they are doing, they are prioritizing their studies. If we talk about the children, school going children, college going children, so they are prioritizing their studies. If we talk about the young generation who are doing job, so they prioritize their targets. they don't have any timetable for their eating habits. They don't have any sleep pattern, and they don't have any exercise schedule. So sedentary lifestyle is one of the major cause for this, and building insulin resistance in them. And another thing is that there is no sleep pattern. So these are the things because of which young people are also falling prey to type 2 diabetes.
True, I think you are very rightly nailed it that that we are like all of us are literally running. चाहे वो बच्चे हो, चाहे बड़े हो, चाहे professionals हो, everybody seems to be, it's like a rat race going on. And in that, somewhere we forget our diet, we forget the lifestyle, we forget what is important. So I think you very rightly said about, how why we are facing these issues. So this, I think, question again, as you said, that WHO also has now agreed. So can diabetes actually be reversed naturally? And how does Ayurveda approach reversal? I think you've touched upon briefly before, but because everybody is like, नहीं नहीं ये नहीं हो सकता, reverse नहीं हो सकता. So what do you think that do we need to really go under some kind of medications, or can we do it in a natural way?
First of all, I would like to share with you that many of the influencers I'm seeing now that they are claiming that diabetes can be reversed naturally, but it is not true. We cannot reverse it naturally because see, if you get fever, if you get typhoid or whatever TB, all any kind of ailment, so you need medicine to treat that. So diabetes is just like that. It is a metabolic disorder. It is a vascular disorder, so definitely you require medicine. So what people think about the natural way, that is the Ayurveda is the natural way. But still, again, I want to address some point regarding this. Herbal is different and Ayurvedic medicine is different. Whenever we are talking about the medicine, then definitely it patient has to get assessed by the doctor, and then the doctor will give him the medicine which will be processed medicine. So after deciding, after assessing the patient, after seeing all the lab investigations, doctor will prescribe the patient certain medicine. Okay, it is not just the plain herb. That means you eat this thing, this herb and that herb, and it will reverse your diabetes. So will never happen because we have to advise the patient lifestyle corrections. We have to give him proper medicine. And cause of the diabetes is insulin resistance. So it should be removed from the body with the help of Ayurvedic Panchakarma therapies. When the insulin, fasting insulin, how we assess insulin resistance, we advise patient to go for the test which is called fasting insulin, and it is high in those patients. So whenever we are giving Panchakarma therapies to these patients, then the insulin resistance get reduced, and when it gets reduced, your body's insulin manages that sugar, and because of that, your allopathy medicine, you need not to consume those medicines because already your body is managing that sugar, and your sugar management is absolutely normal. So definitely we can reverse the diabetes, but with the help of Ayurvedic medicine and Panchakarma treatments, not with the not never, and it will never get reversed naturally. So this is the thing, that means herbs. If you want to use herbs, that those herbs can be used as a supplement to give nourishment to the tissues, but they will not reverse diabetes. So self medication is really harmful. So one should visit the Ayurvedic doctor who is in a diabetic reversal.
Right. So I think very well said that there is a combination of a lot of things which will actually help us reversing diabetes. So I think diet lifestyle definitely is one, but there will be some intervention, as you said, required. And rather than going for a lifetime of modern medication, we could look at Ayurveda, which can, through certain medicines and Panchakarma treatments, help reversal in a proper technical way
Right.
rather than just yeah. So I think that's something which even I was not aware of, that I thought कि अगर सिर्फ diet और lifestyle करें तो भी हम कर ही सकते हैं, but that's again something that we have made us aware about. So going further, we also understood that diet and lifestyle तो definitely आपके diabetes को affect, like it adds to us getting diabetic. So does stress or sleep or emotional imbalance also affect blood sugar? Like, is there beyond the what we can see outside, because diet और lifestyle तो हमको दिख सकता है, but ये जो आप बोलते हैं कि somebody going through some emotional issues or some very much stress, does that also add to our levels of blood sugar varying and leading to diabetes?
Yes, definitely. See, what Ayurveda says about sleep, Nidra yatam balam pulsam. That means Nidra means sleep. Sleep is the strength of the human being. And if the patient, or if I will say person, if the person is having proper sound sleep, and he or she will remain healthy. So whenever we are talking about sleep, stress, or emotional upset, so these are three kind of stresses. So whenever we are using the word stress, tension, anxiety, people may think this is the English word, but this is the medical word. So what is stress? For example, I would like to give you a very nice example. Most of the times, what we see, the young generation, they are going for clubbing, pubbing, and they are partying at late night. So what happens? Though they are thinking they are enjoying, but they are staying awake. If after 10 p.m., then definitely the stress hormone, which is called cortisol, is going to increase in their body. And this increased cortisol hormone will definitely raise the blood sugar levels. So, and it will definitely build the insulin resistance. So, it is really very necessary that one has to go to bed at right time. That means one should not stay awake after 10 p.m. and one should not sleep after one should wake up before 6 a.m. That means in the morning one should wake up before 6 a.m. So 10, one has to go to sleep at 10 p.m. and one has to wake up at 6 a.m. So these are the 8 hours. You should not calculate that I will go to sleep at 12 at night and I will wake up at 8 a.m. in the morning. So this is how the 8 hours quota, it should not be completed because it disrupts the hormonal levels in your body. So right time of sleep is very important. So I would like to give a very nice three in one solution for this. For example, what we have discussed right now: stress, sleep, and emotional upset. So for these three entities, one beautiful herb is mentioned in Ayurveda, that is called ashwagandha. Okay, ashwagandha is really very good. It it will give you sound sleep. It will reduce your stress levels. It will reduce your cortisol levels, and definitely it is very good for your emotional health. So this kind of supplements patient definitely can consume with all the allopathy medicines. And this is how, whenever the patient is on allopathy treatment to reduce the sugar levels in that, at that time we are giving this kind of supplements which reduce their cortisol hormone levels, and which is the cause and which will lead them towards diabetes reversal.
Great. So I think we all have kind of a recommendation of ashwagandha, because I think आज के दिन में बहुत सारे लोगों को ये प्रॉब्लम आती है कि वो नींद नहीं आती है, और ये बच्चों में भी देख रहे हैं, बड़ों में भी देख रहे हैं. And if you ask them, then they are like, we are tired, we had a hectic day, but still. So I think it is the
And it
high
is safe
stress.
for any age. It is safe for any age.
Any age.
So
Okay, great.
even children can consume it, youth can consume it, and
Okay,
geriatric patients, they can also consume it. And not
consume.
only patients, all kind of all population can consume it.
Okay. And we have heard about one more herb, and maybe you can correct me. Brahmi. Does that also help? Is that also some herb which is,
Brahmi is definitely good. Brahmi is definitely good. But
okay.
ashwagandha is having another effect. That means it works on the muscles. So
Okay.
what is
Okay.
very important, that if you give strength to the muscles, then the muscle mass increases and sugar go directly into the muscles and your insulin reservoir get protected. So that is why
Okay.
ashwagandha is really very important. Brahmi will definitely give you sound sleep, but
Right.
ashwagandha will work on all these aspects regarding diabetes.
Okay. So that's quite interesting. So going forward, Ayurveda talks about Agni, yeah, or digestion as the root of health. So how does poor digestion contribute to diabetes, and how can one work on that?
Okay. Agni, that means metabolism. So Ayurveda says Roga Sarvepi Manditno. Rog means disease. And Manda Agni, that means rate of metabolism, it gets closed down. Okay. So as we are talking that diabetes is a disease of metabolic disorder. So in that regard, I would like to throw a light on it. That means whatever we are eating, it is getting converted into nutrients, and whatever the part which is not needed to the body, it is thrown out of the body or eliminated out from the body in the form of stool, urine, and sweat. So, if the rate of metabolism, if it gets decreased, then what happens? The nutrients will not form in a right way. So, you will suffer from vitamin B12 deficiency, vitamin D deficiency. If you are saying that we are getting vitamin D from sunlight, but still, if you are consuming vitamin D tablet, it will not get absorbed properly. That means the bioavailability will get decreased. So the thing, if the rate of metabolism is low, then the nutrients will not be formed in a proper quality and quantity. And whatever the things which should be eliminated out from the body, it will not get eliminated out from the body. It will accumulate in the body in the form of insulin resistance. And if consider there is a cell, and on the membrane of the cells there are locks. So this, does this lock come from? Where do these locks come from? So it is the insulin resistance. So with the help of Panchakarma therapy, we remove this insulin resistance, and that is how the insulin start transporting the sugar in the cells instead of blood. So from the blood, the sugar levels get decreased, and this is how we reverse diabetes. So Agni plays very important roles, and all the Ayurvedic herbs. That means many people are having doubt regarding diabetes, how it gets reversed. So there are certain medicines, there are beautiful medicines, and there are many medicines which increases the rate of metabolism. And that is why the if the patient is obese, then definitely his weight will reduce down, he will reduce in inches, and he will not get and with less efforts he will able to do all these things. So so his cholesterol will get reduced. So there are many benefits of the Ayurvedic medicines which will increase the Agni, that means which will increase the rate of metabolism. And with the help of Panchakarma therapies, we are removing this dirt from the body, which is we are calling insulin resistance. So, what is the aim of the treatment? To increase Agni. That means to increase the rate of metabolism. So, Ayurveda gives immense importance to Agni.
Right. And what are those herbs, if we can understand like one or two, maybe? I'm sure it is person to person, but
Yeah,
something which our
still I
viewers
would
will
add
like to
that.
know.
Yeah, sure,
Yeah.
definitely. So
Yeah.
you must have heard chitra, you must have heard black pepper, you must have heard ginger. So this is very beautiful herbs. They are little hot in nature, and they remove the dirt from the body. And of course, Panchakarma therapies are there, but before going for Panchakarma therapy, we are giving such kind of herbs. Those increases the rate of metabolism. There is beautiful medicine Panchakola, so it improves Agni. You must have heard that marich powder or pipali powder. So these are the beautiful herbs which increases the rate of metabolism. So anyone can consume it, and it gives not only the best result in diabetes, but it is really very it gives beautiful result in hypothyroidism also, in high cholesterol condition, in increased triglycerides levels, in obesity. So these are the metabolic disorders. So this in this kind of spectrum, these medicines work beautifully.
ग्रेट सो आई थिंक फ्यू वर्ड्स तो ऐसे कि जिंजर हो गया ब्लैक पेपर हो गया ये तो हमारे किचन में भी अवेलेबल है
Delhi,
सो आई
yeah.
थिंक इवन बिफोर पीपल एक्चुअली यू नो गो एंड स्टार्ट टेकिंग मेडिकेशन आई थिंक वी आर किचन इज अ फार्मेसी वी शुड स्टार्ट विद
Sure, sure.
सो
Yeah, yeah,
या
yeah.
So going next, many people try to eat healthy but still struggle with sugar levels. I think this is very very interesting one
Yeah, yeah,
where people are saying कि हम तो बहुत clean खाते हैं, हम walk भी करते हैं और फिर भी हमें diabetes क्यों हुआ? So is there like is there something which is going wrong, or are you saying like what does happen actually for such in such cases?
absolutely true. See, there are two groups of people. One group is eating fast food, unhealthy food, and they have developed diabetes. And another people, they are eating homemade traditional food, and still they develop diabetes. And both of them are struggling for keeping the blood sugar levels normal. So, what is the secret behind it? How it should be addressed? So, see, if we see our ancestors, they were eating carbohydrate-rich diet, but their main occupation was agriculture. So they had to do lots of physical work. But what has happened with the second group? They are eating the same diet, that is the carbohydrate-rich diet, but their physical activity is get reduced because all the physical activity is replaced by machines, and they are not doing the exercise regularly, or even they are not doing exercise. So what has happened? Insulin resistance get built up in their body. So how a food should be? So the thing is that the food comprises of five components: carbohydrate, protein, fat, vitamin, minerals, and fibers. So what people are doing, very common example, have you seen the conventional tiffin box? A very small box is for sabji, and the large portion is for chapati. So people are thinking I'm eating homemade food, that is the chapati bhaji. But it is not like that. You have to eat at least, you have to eat fibers more. That means, for example, you should eat sabji more, you should eat salad more. So 50% of your diet should you eat 50% of your diet should be fibers. You eat it, it should be you should eat in a more quantity, and 25% you must eat protein. Okay, so protein, that means all kind of dal you are eating, eggs you are having, all chole, rajma, and this kind of stuffs. That means you can go for sprouts, okay, for protein. And vitamin mineral is already all the components contain vitamin and minerals. And for the fat, you have to consume 1 teaspoon of cow's ghee in each meal. So if your diet is a balanced diet, that means you should not eat only chapati bhaji. You must have to carry any dal in your tiffin, in fact salad in your tiffin. So if it is a balanced diet, then what happens with this balanced diet? You have to reduce one chapati or one bhakri, whatever it is made from jawar, bajra, nashti, whatever. So if you are eating two chapati or two bhakri, you have to reduce one bhakri, and you have to add one katori sabji, one katori dal, one katori salad to eat. And this is how you will reduce the carbohydrate portion. And when you complement this carbohydrate with protein, for example, dal or eggs or sprouts, then your blood sugar levels will not spike in the body. And this is how you will not overload your body with carbs. And this is how it is the right methodology. In this right with this right methodology, if you eat, then only you will find that your blood sugar levels are coming to normal with less number of medicines. And if you're not eating in this way, your blood you will put add on some medicines further, and still you will be struggling to manage the blood sugar levels. So first aim should be to bring the sugar in control with the help of right food habits. And right food habit is nothing but the right balanced diet, low carbohydrate diet. So this is the secret behind it.
Reason, yeah, yeah. No, no, I think that's absolutely right. क्या हुआ है हमारा ट्रेडिशनल खाना वही रहा है, बट हमारा काम बहुत अलग हो गया है. सो
Yeah.
पीपल जो खेत में होते थे आज वो कंप्यूटर के सामने है, एंड स्टिल वी आर. सो आई थिंक दैट्स वेरी राइटली pointed out. So I think next we want to, I think we have touched upon herbs, to manage blood sugar. So how should, I think more, let's focus on कि आपका balance day, how should it look like for somebody who is managing diabetes, like from morning to bedtime, क्या मतलब आई थिंक आयुर्वेद बहुत दिनचर्या पे जो फोकस करता है, सो इज द दिनचर्या वेरी सिमिलर फॉर diabetic people also, or are they asked to do something specifically or differently from morning to bedtime?
See, the dincharya, that is a daily regimen, should of diabetic people and non-diabetic people must be same, because now we have seen that India has become the capital for diabetes, right? So why we are becoming the capital for diabetes? Because we Indians, we do have some genetic predisposition towards diabetes, and if our lifestyle is bad, then definitely we will trigger those things, and the patient will develop diabetes. So it is really very important to adopt certain changes. So in that, first the thing comes with the morning ritual, that one has to wake up in the morning before sunrise. In Ayurveda, it is told Brahma Murta. Brahma Murta, that means at around 4 o'clock, but no one will wake up at 4 o'clock. So I usually advise my patient to wake up before sunrise, and after waking up, don't consume tea or coffee. If someone is saying I am having tea or coffee without sugar, it is literally not good, because it is little bit bitter in taste. Ayurveda advise bitter taste, but it is the medicated bitter in characteristic which destroys the insulin resistance. But some people are eating karela and fenugreek seeds very frequently. So this bitter taste increases what in their body, and increased what leads towards uncontrolled diabetes. So I always advise what Ayurveda has advised: when you wake up in the morning, always have 1 teaspoon of cow's ghee in 1 cup of warm water. So this is the fat, okay? And fat gives you slow and steady energy. Fat gives you best mental alertness, best physical strength, and you have to skip the breakfast, because already you are getting energy from the 1 teaspoon of that cow's ghee, that is the good fat, okay? So you will not feel hungry, your sugar levels will not crash down, and you will get that satiety. So one has to avoid breakfast, and one has to go for brunch and supper. That means, for example, the not breakfast and not the lunch. Instead of that, you may go for brunch. That it is about 11 a.m. And for the supper, you may go for 7 p.m. So you will have your supper instead of dinner. You will have your supper. You have to cut down your evening snacks, and this is the intermittent fasting. This is how it works very nicely. Because see, what people used to do: I'm having diabetes, I have to consume medicines, so I will have breakfast. This is the way. That means I will get the medicines, and for that I will get hurt myself because I want to apply the ointment. It is just like that. So it should not like that. That means for consuming medicine, you don't eat. First of all, you are already full of sugar. You are loaded with sugar. Okay. So if you will cut down breakfast from your diet, then whatever the stored fat, it will break down into sugar, and that sugar will provide it to you in the form of energy. And this is how your allopathy medicines will get reduced, and this is how you will reverse your diabetes. So diet and lifestyle plays very important roles. So what I told: wake up early in the morning, go for exercise in the morning, yogasana, strength training, they are best, because yogasana will work on your mental alertness, and strength training will work on your muscle fitness, and definitely you will lose weight. So this is how exercise is very beneficial. And brunch and supper, that means the intermittent fasting. And another thing is that go to sleep at around 10 p.m. or before 10 p.m., but do not stay awake after 10 p.m. So this is how, if your lifestyle will be like this, you will not suffer from diabetes, not any other disease.
No, I think this is again something which has come as a great insight. But I've heard that people say that अगर आपको डायबिटीज है तो आप 2 से 3 घंटे से ज्यादा बिना खाए नहीं रह सकते because sugar levels dip होते हैं. I do not know. I'm just asking this, like does that happen? Like you cannot fast for very long if you have diabetes?
सी कैसे होता है ये पहले का था. मैंने कैसे बोला, 19th century में लोगों को, मॉडर्न मेडिसिन को फिजियोलॉजी और बायोकेमिस्ट्री पता चला है. अभी 21st सेंचुरी चल रहा है, तो 19th सेंचुरी से 21st सेंचुरी तक बीच का जो पीरियड था उसमें ऐसे ही बताया जाता है कि यू हैव डायबिटीज, so you should not skip your meals because you want to eat that medicine, okay? But अभी मॉडर्न मेडिसिन को पता चला है कि डायबिटीज रिवर्स होता है। कैसे रिवर्स होता है? ऑलरेडी आपके पास बहुत ज्यादा कार्बोहाइड्रेट का रिजर्वायर है। कार्बोहाइड्रेट इज गोइंग टू कन्वर्ट इनटू द शुगर, ओके? सो अगर आप नहीं खाओगे तो वो शुगर आपकी यूटिलाइज होगी और वो ब्लड में नहीं रहेगी। सो यू हैव टू स्किप योर मील्स, और आपको ये सब अपने मन से नहीं करना है। यू हैव टू विजिट टू योर डॉक्टर एंड योर डॉक्टर विल गाइड यू कि वो गोली कैसे लेनी है। फॉर एग्जाम्पल ब्रेकफास्ट के पहले रहेगी तो वो आपको ब्रंच के पहले करके देंगे। सो इट शुड बी अंडर द गाइडेंस ऑफ डॉक्टर ओनली हु इज इन डायबिटीज रिवर्सल। और अदरवाइज अगर आप बार बार खाते रहोगे तो व्हाट विल हैपन, आप ज्यादा कार्बोहाइड्रेट का इंटेक करने वाले हो, ज्यादा शुगर बनने वाली है, और वो ज्यादा शुगर को मैनेज करने के लिए फिर से ज्यादा गोली, फिर ये ट्रैप में फंस जाते हैं पेशेंट। So we have to break this vicious cycle. We have to reverse the diabetes timely and with the help of right food habit, and intermittent fasting is best for it.
Perfect. So I think finally we want you to give us the top three habits to prevent or control diabetes before we conclude the session. Yeah.
डेफिनेटली बार बार हम एक ही बात बोल रहे हैं कि फर्स्ट थिंग इज दैट लो कार्बोहाइड्रेट डाइट एंड पोर्शन कंट्रोल, राइट? कितनी भी भूख हो आपको लो कैलोरी डेफिसाइट में रहना है। जैसे हम पहले बोलते थे दो निवाले कम खाना, जब ये बोलते थे हमारे दादी बोलती थी, हमारे घर के लोग बोलते थे, तो हमें वो साइंटिफिक नहीं लगता था। But when we give consultation to a doctor, your doctor will advise you कि calorie deficit diet लो। इसका मतलब ये होता है दो निवाले कम खाना। तो ये पहला रूल है डायबिटीज का। The second one is that one has definitely आपको रेगुलर एक्सरसाइज करनी है। मतलब ये जब आप एक्सरसाइज करते हो तो आपके मसल शुगर अपटेक करते हैं और आपका इंसुलिन रिजर्वायर बढ़ जाता है। तो सेकंड हैबिट इज आपकी एक्सरसाइज। एंड थर्ड एंड सबसे इम्पोर्टेंट है जो आज कोई नहीं कर रहा है, दैट्स स्लीप ऑन प्रॉपर टाइम। 10 बजे सो ही जाना है, अदरवाइज कोर्टिसोल बढ़ने वाला है, डायबिटीज भी बढ़ने वाला है। So these are the three things: right food habits, exercise and proper sleep. अगर ये तीनों करते हैं ना तो सिर्फ डायबिटीज नहीं, कोई भी बीमारी नहीं होगी।
I think the three pillars, and I think of good health, I should say. So I think thank you so much, doctor. I think it was very insightful, and today is also the diabetes day. So we are actually recording this session on Diabetes Day, which is 14th November. And I think we all are really thankful to you for sharing such wonderful insights. And I really believe that if people are following those three pillars of strength of health, and in case they have diabetes, also to come and consult you or Ayurveda as the line of treatment, and they could really see wonderful results. I think that's something which the whole today's podcast was focused on, to tell them that it's not always that you have to be dependent on medication for life. Diabetes can be managed, it can be reversed, and Ayurveda is wonderfully doing and giving very, very good results. And we know that we have sent a lot of patients to you, and they have had wonderful results. From I remember one of the recent patients whose HB1AC has gone from 13 to, I think, roughly around 7.88, and they are still looking to come down. And it was purely, and that person was for ages on medicine. So thank you so much, doctor, for sharing it. And thank you so much. Yeah. And for the viewers, Dr. Gaurangi has her clinics across Mumbai, and definitely we'll share the profile link where you can reach out to her, you can consult her, and you can take the benefits of the wonderful science of Ayurveda. So thank you so much, ma'am. Thank you. Thank you, ma'am.